Well, welcome everybody. This is the emergency response segment. My name is Patty Esmail and I'm one of the clinical educators here at CHI St. Vincent. I've been here since May 23rd of 1988, so just for a little while. Background's in critical care, so I think that's why they asked me to do emergency response. Like I might know something about it. So to begin with, this is what our crash carts and our defibrillators look like. We have the Zoll defibrillators throughout the system. If you work at the infirmary, you will have the Zoll R series with AED capability. If you work at the Morrilton or the North campuses, currently you have an M series, which does not have AED capability and does not have the ability for you to get CPR feedback while you're performing compressions. But the Zoll operating system is the same regardless. Anything that has to do with defibrillation has red. Anything that has to do with pacing has green, so it doesn't matter what model you've got, they operate the same way. Our crash carts are set up so that we have two different models of crash carts. They're both blue, but we have one that is set up like this, where there's a breakaway lock. You lift it up, you push it in, and then you can have access to all of the drawers that are here. The backboard pops off. I say it pops off. Comes off of, there's a little pin down here, there's a little hole that you have to correspond to fit it. On the other model of crash carts, the backboard is not locked in. It hangs off the side of the cart so that you can easily access it for when you're having to do CPR. But regardless of what style of crash cart you have, whatever is in the top drawer, on this model, it's up here, airway. Then on your second drawer you have your needles, any ECG supplies, and by that I mean electrodes. Your documentation forms also sit in that drawer. The next drawer down has your IV supplies, even down to a triple lumen, should you need it. The next drawer has your drugs, and inside that drawer is the drug box. When the drug box is inside the drawer and you receive it, it has a green zip tie around it. Let me find, because ours has, we use it for demonstration purposes. So when you receive it, you have it, sorry. It has a green zip tie around it. That lets you know green means go, right? Green means go, so that means we haven't used it yet. You break away the zip tie. You use whatever drugs you're going to use, standard emergency drugs, you know how it goes. Mustard yellows, bicarb, yellows, calcium, purples, atropine, etc. But inside you'll find a red zip tie. Red means stop. So when you get finished with your code, will replace the lid, and then you will run the red zip tie through it to secure the device. Look, I can't even find the hole here. To secure the device, because it may not necessarily be a licensed person that is transporting this crash cart, and we need to make sure that the drugs are secure if a non-licensed person is handling the crash cart with the drugs. They'll take that down to Central Supply, and everything is secured. In the bottom part's where you're going to find all the other things that you didn't have. Ambu bag, suction canister, suction head, the stuff that you need if you need to do a difficult airway. We have the AeroGlide and forgive me, I cannot reach it. The AeroGlide and the bougie. The AeroGlide, so the video for doing those difficult airways, and the bougie introducer are located down here as well. We do have difficult airway carts, but since we put those on every one of the crash carts, they don't have to wait for the difficult airway cart to get there. Turn it on. Whenever we use the defibrillator, it's always unplugged, but when it's not in use, can you see my screen here? I have a simulator attached to it And I gave it VFib, and it automatically analyzed it, and it says the shock's advised. Told us to stand clear. Now this red light has lit up. That means that it's fully charged and it's ready for us to make sure that the scene is safe. Everybody clear? And discharge and gives the prompt to begin CPR. If you need to use this in manual mode, so you've been rhythm trained, there is a soft key down here that says manual mode. If you push it, then all of a sudden those controls that you were used to seeing on your defibrillator that you can see on the M series, you now can see they're all lit up. Now you have control of the device and you'll tell it what to do. But for the most part, we use it in our AED mode so that we can respond as quickly as we need to respond. We want to make certain that we get early CPR and we get early defibrillation so that we have the best possible patient outcomes for those that we care for. Scientific evidence says that if somebody goes into a shockable rhythm in the hospital, if we don't give the first defibrillation within 2 minutes of the onset of that rhythm, the likelihood that they'll discharge alive from the hospital is almost zero. So it's critical that you know how to alert someone and what it is you need to do to respond in an emergency event. So let's take that from there. Let's say we've got our crash cart here. And I'm going to ask for some participants from the audience. So at the infirmary and at North, the emergency number is 8500. You guys probably got that on your first day of your orientation. The number at the Morrilton campus is 1500. And Hot Springs has their own number for emergency response. But remember, it's code blue, code red, whatever that emergency alert is, whether it's a rapid response, 8500. You tell the operator what floor you're at, the room number, and what you're calling about. So I've got Kelly here, and Kelly comes upon her patient. She makes her assessment, and remember those first steps of BLS, right? Assess responsiveness. Her patient doesn't respond. So then she's going to look to see if there's normal respirations and check for a pulse. No less than 5 seconds, no more than 10. There's no pulse. She knows her patient's in trouble, so she's going to call for help. And she's going to tell someone to dial 8500 and to get the crash cart. And then she's going to start compressions. I roll up with the crash cart, and I'm like, Kelly, here's the crash cart. Let's get the backboard under them. We have our one-step patches, which front and back. The rectangular one goes on the back. The anterior one goes on the front. And this little puck here goes on the lower half of the sternum. It's critical that you place this in the right place. You don't have to do compressions while we're writing on this. Critical that we put it in the right spot because it's going to give us feedback on the quality of the compressions that we do. And then this triangular electrode fits on the chest. Please note that on the one-step patches, the 3 electrodes are already incorporated into the patches, so you no longer have to hook up the 3-lead system. But if you have the M series, you will not have the one-step patches. So it's imperative that if you needed to do a synchronized cardioversion or you needed to pace somebody, you have got to hook up the 3-lead electrode for the ECG along with your anterior and posterior patches. Okay, so let's roll him on his side and let's put his posterior patch on. So we want to put it back here where the heart is, drop him back down, and then we're going to take this anterior patch and we will put it on the lower half of the sternum, and then we'll put the rest of the patch down. And that serves as the landmark for Kelly when she is doing her compressions. We turn on the device. Kelly's doing compressions. The device is going to tell us, stand clear. So we're going to tell everybody, stand clear. It's going to analyze the heart rhythm. It sees that there's a shockable rhythm. It powers up.
Shock.
Everybody clear?
Perform CPR.
Resume compressions. When she does her compressions, there's a metronome on this device, so it can give you the beat that you need. It's giving us feedback. I don't know if you can hear the metronome if I be quiet. So it gives her feedback on how she needs to perform the compressions. It's telling her her depth of compression. It's telling her her rate of compression. It's telling her her release of pressure off the chest. And it's also giving her her perfusion pressure. As long as that form is filled in and colored, that means she's got good compressions going on.
Good compressions.
Remember, compressions are hard. So it's difficult to do quality CPR. So if there are other people, we need to switch out. We need to make sure we switch out. But my timer here tells me I've got a countdown of a minute. We took care of this patient, found out that they were in trouble, put the patches on them, and we delivered the first shock in less than a minute. We have given this patient the best possible chance at having a positive outcome. That's what we can do. So remember, we want to be familiar with our crash cart, know how to work the defibrillator. We also want to know we've got to get those patches on. We start early CPR, get the patches on, shock them if they need it, and continue with that CPR. Anybody have any questions?
So the patches at North and Morrilton, do you have what they look like as far as the shape or?
That's a really good question, Sandy, okay? Excellent, in fact.
Stand clear.
I'm going to turn the device off for a moment. But you notice that when the 2 minutes were up, it automatically reanalyzed the patient's rhythm. So, Sandy, you asked about it North and at Morrilton. So they have these patches. And these will fit into this. We actually had an episode where there was low, just like right now we have some challenges with PPE. There was trouble with getting the one-step patches for these devices. The hookup is just a little bit different for the M series. The M series does not have the ECG component. For this one, the ECG, the 3-lead, because you can hook up just the 3 leads, plugs in here. But all they have is just this part. This part just fits right in here like this, just like it always has. Single movement. It's got a little alligator clip there to hold it down. So I can put it together with one motion, but I have to make a concerted effort to take it apart. And then with this one, both of the patches are the same size. It doesn't matter which one goes on the front and which one goes on the back. The key is to sandwich the heart. We prefer to have an anterior-posterior application as opposed to just an anterior because the distance is less if I have anterior-posterior than it is if I go anterior-anterior, so it takes less electricity to get the job done. It is also recommended to have the anterior-posterior application if you're going to pace somebody, if you're going to do a synchronized cardioversion. But with the Morrilton and the North setup, if they needed to do pacing or they needed to do a synchronized cardioversion, they would apply the patches and then they would just hook up their 3-lead because both of those functions have to be able to track the R wave. But that's a good question, but yes.
Thank you.
Any other questions? All right, then thank you. So we've gone through the other drawers. There are drawers on the side, and this holds true for all of the carts. The drawers on the side have your IV fluids and IV tubings. Not much, but just enough to get you started and let you be moving through the code. If you need more than a liter bag of saline or more than what's here, you're going to have to go to your supply Pyxis to be able to get those other elements. Little information you need to know. The State Health Department requires that we check the crash carts, that we check our crash carts to make certain that our crash carts are ready and that our defibrillators can function. The defibrillator is always plugged in. When it is not in use, it is plugged in. When we do our defibrillator check, We always do it with the device unplugged because the purpose of the defibrillator check is to make certain that this device will operate without being attached to electricity. The R series has a readiness window, and when it is ready, it has a green check mark in it. You might come across it and it would have an X. This model is designed to do self-checks while it's plugged into the one-step patches. But if the patches are expired, if something happens to interrupt the electricity, and plus it's plugged in, so we have to check the device when it's not plugged in. If you have it plugged into one-step patches, that's great because you can do the check. But if not, there is a port on the side where you can plug in the cable into the side. You have to take your device, you turn it on, and you do have to be in manual mode to make this happen. And when you check the device, you check it at 30 joules. So I'm going to have to take my energy select button and take it down to 30 joules. Once I've got it at 30 joules, I'm going to tell it to charge. Once it's fully charged, again as it did when we used the AED, it lights up. I don't have to say clear unless I just want to make sure I'm clear myself. And then you'll see it said the 30 joule test was okay. And I've got a green check mark in the box. That means that this defibrillator checked out, everything's functional. Paper in your recorder, it'll read out, it'll tell you that that self-test was okay. You're going to tear off that paper and you're going to dispose of that in the trash. It doesn't have any patient information on it, so you just go in the trash can. That's how you check this device. Remember also, when you're checking the crash cart, we have our crash cart log, and there is a documentation sheet inside this book for your shift checks. So if it's a 24-hour unit, you're going to check it on day shift and you're going to check it on night shift. Also, you'll find inside this book the algorithms, just in case you forget. You've got copies of the algorithms there. When you're looking at the crash cart, you're looking to make certain that it's locked and it's secured, that that breakaway lock is intact. You'll also go over to your oxygen tank, and you want to make certain that your oxygen tank says that it is full. Nothing less than full is acceptable on the crash cart. If it is not full, then you need to replace it. You'll find those E-cylinders on your unit in your oxygen tank storage area. You'll put a full one on. Most of you probably know how to change out the regulator. If not, I'm sure there's someone that can show you how, or respiratory therapy can help you with that. On the top of the crash cart, you're going to find a sticker that tells you when the first medication expires. So you're going to look for your medication expiration date, and there'll be a second sticker that'll tell you when your first supply expires. So not only are you checking to make sure that the defibrillator works while it's unplugged, you're looking to make certain that the crash cart is locked and secured, you've got a full oxygen tank, and you don't have any expired medications or supplies. And that's what we're looking for when we check the crash cart each shift.